and you learn to develop a way, a very unique technique on your own to operate on this Vietnamese patient?
I practice and I have to devise way of perfecting the technique. It's not until 2002 that I feel very confident about my surgery.
But what people were talking about, the whole medical world and the doctors and patients were talking about, is about the new technique, the new lens.
Well, the lens has been around for some time. It was invented by the company called Alcon. It's called the AccuSoft Restore lens.
Right.
And it has the special capability of allowing one to see far and near without having to use the eye muscle. What I contribute was the ability to do the surgery in such a way that the lens will work most of the time. And that's my key contribution. And to do that, you have to get the lens into the right place, into the right location where it used to sit.
You have to be exact.
Yes, the exactness, the accuracy is what I need to achieve in order to get the result. And to do that, it almost demands perfect surgery. And the perfect surgery here, I mean, is to be able to remove a lens,
a
natural lens, be it a rock-hard lens or a soft lens, and to save the capsule in its perfect shape.
Right.
So I can insert the AccuSoft Restore lens in the right place so that I can achieve the result that the lens is supposed to achieve.
No room for error.
And it's like building block. It's like you're building a pyramid.
Yeah.
You start with the foundation, and it's one step depends on the step previously. If you make a mistake previously, you cannot go on to the next perfect step. So it's like building block. It has to be one block after the other.
It has to correct at the beginning.
Yes, so every step has to be correct in order to get to the perfect solution at the end.
How many patients have you been operate on this new lens?
Oh, I'm close to 200 at this time, and I didn't come out with it. It was the company offered me this lens. They would like me to try it, and I asked them why did they choose me, and I didn't realize that they had tracked my record.
That's right.
And they have found that I did not break a capsule. In fact, all the 3 companies who are making lens right now knew that they know that I did not break capsule. And what happens when you break the capsule, you have to use a separate lens. And also you have to use different instrument to save it. To save the eye.
Did you find it challenging to take on that experiment?
Well, I really enjoy it. To me, it's not really work, but it's a love for my work.
I heard that you also do like thoroughly examination. You educate your patient, give them an option, or educate them, tell them what option they have in order to choose instead of making decision for them.
My rule is always respect the patient's decision. And the way I approach it is I would be the advisor and I would give the advice, but ultimately it's the patient who makes the decision. Now, patients are very sophisticated these days, like yourself. You learn everything about the procedure before you go through it. And I appreciate that. I found that's probably the best way for the surgeon to be connected with the patient, is to have the patient know all the options, know all of the available technology out there, and for the patient to make his or her own decision. And that's very exciting for me because I'm always very impressed with how my patient come in and they would know all of this, and they would say, now Dr. Pham, which one you think is the best for my eyes? Now that saved me half the work already, that I don't have to go and tell them all the options.
Wonderful. Thank you so much. It was a great pleasure talking to you. I have learned so much already, and you will be looking at your next patient right here. Thank you very much for joining VATV in San Jose, California. This is Kieu Thu. We will see you back in Washington, D.C. next week.